Alright, so the purpose of this video will be to introduce you to the Marie framework or the Marie process, which is one way to critically analyze a study. And I hope by using this organized and logical method, you'll feel comfortable picking up any journal article when you're done with this class and knowing how to determine if it was done correctly and if it's something that you might consider implementing in practice. That you won't skip over sections because you don't know what you're supposed to find there. And so you need these two things as you watch this video lecture. You need a copy of the week 2 homework questions. So I would go ahead and print out a copy of those so that you have a hard copy in front of you, and I've done that. And the other thing you need is a copy of the study that I'll be using to demonstrate the process over the next couple of weeks. You're going to be analyzing a different study. It wouldn't make sense that I give you the answers and then ask you to give those back to me, would it? It might be easier, but it's not the desirable outcome that I want. So you're going to download a copy of this dexmedetomidine study, and when I do it that way, I've opened it on my computer, I've opened it on the web browser, but I don't really have it saved to my computer, and so I can download it here and then save it where I'd like to save it. And when I open it from that location, so let me go there really quickly, if I can do anything quickly. And when I download it from my Critical Review Healthcare Research Study file, do you notice that it's open in Adobe Reader instead of the internet? And so now I have a copy saved to my computer. I'm going to print out a copy because it's, when we're going through this process, it's much easier to have it in front of you so you can see what I'm seeing. But if I have it open in Adobe Reader, it can actually do things for me, like if I put view, it could read it out loud to me, and it doesn't do a very good job of it. It mispronounces a lot of the medical terms, but it might help put you to sleep or something. But it would let you do things like search. So if I go to edit, I can use the find feature, and I can do that from the internet too. It's just that I may get used to doing it in one system rather than several different systems. So I've got my list of Marie questions in front of me. I've got my copy of this study in front of me, and when I first pick up a study, I encourage you to do these two things. Any study, I want you to read the abstract and I want you to read the introduction, and they're not very long. So the introduction may not be labeled that way, but it's going to be those first couple of paragraphs before you get into the methods section. Now, do you remember what we were talking about today? We are using the first 3 sections of the Marie process, which were, so that you can see them on the screen here, we are looking at the questions from the method section, the questions from the assignment section, and the questions from the assessment section. So we're doing the first 3 letters of that Marie acronym that helps us remember one way to approach a study. And it says the first thing we're going to do, once we've read the introduction and the abstract and kind of have our sea legs under us for what this article is about, there's a recipe that I'm wanting to try. Let's get rid of it for a minute. And you're going to then evaluate for conflict of interest. So that's the first question, and there's some examples of questions that help you when I open this document. These are not individual questions that you have to answer every one of those. It's giving you guidance for what are you looking for. And really what I need from this is, I believe a conflict of interest may exist because, or I believe a conflict of interest is unlikely because, and this gives you some examples of things you look for. Typically, when I pick up any study, the conflict of interest information is going to be kind of found in this. So it's going to be found of who are the authors affiliated with. The primary place I'm going to find the information of conflict of interest is at the end of the study as we start the reference section. So look at all this information right here, and I can make this larger really quickly. I'm going back and forth between different systems. What I told you not to do. Do you see though, it's telling me who were the authors, and you say, oh my gosh, I can't write down all those. You're right, but I look at them and I say, okay, these were authors from Japan, authors from, it looks like they were from various places, and I would just write that. The authors were from various locations in Japan in different critical care medical centers. Then I would read this information on the author contribution. And so it says, hey, this person was in charge of this piece, this person was in charge of this piece. And again, I'm not having to write all this down. You're kind of convincing yourself, does it look like there is a conflict of interest present? And in the week 2 assignment document, it explains what's the purpose, why do we look at conflict of interest? So it says all authors submitted the form. It tells you what fees they received. And so, well, here we go, Pfizer, and this is a study that's about a medication. So I might just really quickly look and see, hey, who funded this study? Well, it was from a research grant, and it looks like it came to a university, and it says the people who funded the study were not told that they could have any role in conducting the study, or they weren't able to decide whether the results of the study got published. So I would probably answer this question and say it's unlikely that there's a conflict of interest. The authors were from several different locations or facilities in Japan. The authors all completed conflict of interest disclosures. The funding came through a non-contractual research grant. Now that could have been from it could have been a non-contractual research grant from a from a drug company, but it says that funder was given no control over the data or the decision to print the information in the study. Okay? So that would complete that answer. Just make sure you answer the question and provide evidence to support it. So now I'm going to go to question 2, and what I'm going to do here is let me get this opened up too. So what's question 2 that we're trying to evaluate now? The study hypothesis. And where am I likely going to find that? In almost every study, the study hypothesis, that seems redundant, doesn't it, will be at the very end of that introduction section. So let's go back to the introduction section. So typically it's going to be in this last paragraph. So here is their hypothesis. Gosh, they even say that, huh? So I could cut and paste this. I could say that dexmedetomidine or Precedex would improve patient-oriented outcomes among patients with sepsis. And those patient-oriented outcomes were improved mortality and ventilator-free days. So I could cut and paste this. If you cut and paste, remember to put it in quotation marks. And I won't make you do a reference for each one of those because I know what study you're analyzing. But if you're going to cut and paste, don't just take big sections. And in this case, it's because it's in a couple of sentences, I would probably put it in my own words. The other place I could find the hypothesis, or at least the hint of it, is going to be up here in the abstract in the objective section. So to examine whether a sedation strategy with dexmedetomidine can improve clinical outcomes in patients with sepsis undergoing ventilation. Well, that's great, but it doesn't really clarify what those clinical outcomes were. And there are 2 that they said. It was mortality and ventilator-free days. So I would expect that you to include that information. So don't just cut and paste. Know what you're looking for. What are they really analyzing in this study? Why was this study done? All right. Next, let's look at that third question that we're trying to answer with this Marie process. We move to study population. And here again are the things you're trying, these are your hints. What is the specific population being investigated? What are the inclusion and exclusion criteria? And some of this information it says might be in supplementary material. And I'm not expecting at this point that you'll dig in that supplementary material. I'm going to always provide it for you. But I don't expect that you'll have to go that deep. You may do that on your final analysis assignment and maybe some of our practice assignments, but not this one as we're just starting out. So what specific population is being investigated? I need to answer that piece. What are the inclusion criteria, the exclusion criteria? Let's find that information. So this is in the methods section of the Marie framework. Look at what this section is of the study, methods. So use those headings to help you know where you're going to find it. So it says, who was your population? Well, let's look for that. Well, let's see. Here is they are 8 ICUs, patients from 8 ICUs in Japan, and the study was conducted from February 2013 to January 2016. So that's my population, was patients who were admitted to an ICU in Japan between February 13 and January 16. Next, I'm going to look at how did they include people and who did they exclude. So patients who were 20 years of age or older, patients who had sepsis, patients who needed mechanical ventilation for at least 24 hours. So again, I could do some cutting and pasting here. I'm looking for inclusion criteria. That's my inclusion information. And then I'm going to be looking for exclusion criteria. Now, I would not cut and paste all this information with how they define sepsis, but the other thing you can do is, remember, in both of the formats that you may have this open in, you could use your find. What if I look for exclusion? Detailed inclusion and exclusion criteria are provided in Supplement 1, so I might have to go there. I'm not asking you to do that for your study. In most cases, in the methods section, it may even have a subsection that says inclusion criteria, exclusion criteria. So for this one, let's just take what's in the study as an example. Patients who are 20 years of age or older who had sepsis and needed mechanical ventilation for greater than 24 hours were eligible for the study. Okay, I don't need this information on how they define sepsis. And because fluid resuscitation, I'm trying to see if they say exclusion here. And it looks like their exclusion information is only going to be there. But here are some, if you were pregnant or lactating or were allergic to dexmedetomidine. So I think these are the ones. Here we go. Patients were excluded if they had. So here's my exclusion criteria. Here's my inclusion criteria. And I would call it good at that piece. So we did our population, specific population, adult patients in Japan who were admitted to hospitals within this window of time, who were, here's my inclusion criteria, here's my exclusion criteria, and we've answered that question. Okay, let's see where we're moving to next. We're still in this method section. We have one more piece left, sample size and statistical power or study power. So how many individuals are included in the study? How many are in the control group? What is the study power? And are the participant numbers, are there enough people in each group to study or to power the study sufficiently? And then what is your evidence? And some sort of statement then, these are your hints, remember, about the study being powered sufficiently. So let's go back to our study then. We're not at randomization yet, are we? We're looking at how many people were in this study, and we're going to find this a couple of ways. And I am going to use my find feature for this. I'm going to look for the word power. I am looking for information about study power, and that is a mathematical process that's done by a computer. When a person's going to do a study, they would sit down with a statistician and they say, we think this condition occurs this frequently, and we think that we need to find, we think that there's a chance there'll be a 20% difference between the two groups, and the statistician will tell them how many they need in each group to power the study sufficiently. Most medical studies are going to be powered at 80% power or 90% power. So let's go back to the question list again. One of the things I need to identify is what is the stated study power and how many participants are needed to sufficiently power the study. Well, this study is powered at 80%, and I don't have to write all this other stuff. The researchers said they anticipated a 15% dropout rate, and so they needed 172 patients, period, split between the two groups, to power the study at 80%. They recruited 200 patients and enrolled them is what they wanted because they anticipated they're going to lose some of those over time. So let's see if they actually ended up with at least 172 patients in the group. So I shouldn't be going into the results section, but some of this information might be displayed in a table just like this. So they started with 203 patients. Some of those refused. They randomized, and they ended with 100 in this piece and 101 in this piece. So they did meet that 172 threshold. So let's answer the question then. How many participants were included in each group? There were 201 randomized. 100 were included in the group that received dexmedetomidine. I should just say Precedex. That's a lot easier. And 101 received an alternate medication. Okay? So this study was sufficiently powered because they needed 172 and they had 201. And that would be the correct answer for that question on the Marie analysis framework. Okay, now we're moving to a different section. We're moving to the assignment section. When we go to the assignment section, we're going to talk about the process that was specifically used to randomize people. And in the week 2 assignment document, it talks about what do these terms mean? What does it mean when we talk about blocks or permuted blocks? In this question, you're going to compare, because some of these blocks might be 6 to 6, so they are going to randomize 6 people at a time, so there could be a difference of up to 6 in the number of how many is in one group versus another. So what's the specific method used to randomize participants into the study and control group or groups? And are the numbers of the participants in the treatment control group similar? So is the number that ended up in each group similar? So you say, well, that sounds kind of like this question, except this question was, did we have adequate numbers of participants to sufficiently power the study at the desired study or the desired power level of the study? Okay, now we talk about randomization. So let's go back to our study, and we'd seen there was a section here that talked about randomization. So let's look at that. Here we go. Randomization intervention. Use those subheadings and use these section things to help you. So how did they randomize them specifically? It says they used an electronic data capturing system, and it was done by permuted block randomization, and that's explained in your week 2 assignment document. The block size was 4. Physicians and investigators were not notified of this during the study, so they didn't know what the block size was, how many participants were going in each group. And it should go into more detail and tell us specifically, other than this computerized, sometimes it will tell you the computer generated random numbers. So to answer this question, I would say randomization was conducted using an electronic database system. It was done in a block structure with a block size of 4. Are the participants or the number of people in the group similar? And I would say there were 100 participants in the Precedex group and 101 participants who were included in that final analysis in the other analgesic or other sedative group. Okay, let's see what our next question is. Now we go to confounding variables, and this is where we're going to look at, were the participants fairly similar when they started? And we call that baseline characteristics. And people who publish these studies and who write these studies and submit them know that you're looking for this information. So whether you use the Marie framework or you use an evidence-based care critical analysis process, they're all essentially having you look for the same things. It's just that I think the Marie framework is a little more detailed and a little more structured. So look at the baseline characteristics, and here's your hint. Are there differences between the baseline characteristics of the study and control groups that might affect the outcome? And I want you to think like a researcher, because as you analyze research, you become a better researcher. Think of one confounding variable that the authors hadn't included in those baseline characteristics, or that they hadn't included in their inclusion and exclusion criteria. So let's look at how that might play out as you answer it in your homework this week or as you analyze a study. Let's go to the study then. I'm looking specifically for information not about results yet, right? That's a whole separate section. That's the R of the Marie framework. So if you find that you're moving into later and later sections to answer these, you've probably done something incorrect. I'm looking for a table that will show me baseline characteristics. And I probably skipped it right there. look at this, participant characteristics. A lot of times they're called baseline characteristics, and I'm going to orient myself to this table. So they're telling me these are the characteristics or potential confounding variables that the scientists or the researchers of this study decided could affect whether patients responded better to dexmedetomidine or another type of sedative. Let's look at the age. So I'm basically just looking at what did they choose to look at, and I'm saying, if I were setting up a study and I'm looking at using 2 or 3 different types of sedatives in patients who had sepsis, could the study be affected by how severe the sepsis is that the patient has? And I said, of course it could. Well, one way to know how severe your sepsis is to look at a SOFA score, right? And if you're not familiar with what SOFA scores are, they define what the range is. And you could look it up, but it's a common score when we look at critically ill patients. We use Apache 2 scores, or we use SOFA scores. What if I had more severe shock? What if I had other types of infection that led to my sepsis? So essentially, this is a list of items that you might come up with if you were saying, if I took a patient with sepsis and I'm going to do this study on them, how could I kind of control the variables? So maybe I realize that immunocompromised patients are going to be more sensitive and more likely to have mortality if they have sepsis. So let's see if they looked at immune-compromised patients. So I'm going to have to go back really quickly and look at my exclusion criteria, because those are really ways of controlling variables too. So severe chronic liver disease, MI or severe heart failure, drug dependence, alcoholism, cognitive dysfunction, they were pregnant, lactating, or allergic to Precedex. Well, that still doesn't include information then about immune compromised. So I could say, I think that's one of the things they should have included. And I'm just asking you to come up with one. So do you think cigarette smoking could have affected it? Do you think, so make sure you're not picking something that they've already thought of by including them either in the inclusion criteria or exclusion criteria. Okay, so I have this baseline characteristics and I'm saying, do I think any of the things in here could have influenced because there was a significant enough difference? And I'm just going to look at these, and they're telling me the N means the number in this group, the number in this group, and it means standard deviation in the middle, or it means percentage. So in this case, 63%, which is 63% of 100. How about that? Body weight. Well, yeah, I could see how that could affect maybe severity or your mortality, or how many days you spend on a ventilator. Whether you had COPD could do that. Whether you had emergency surgery could do that. So let's compare the people in these groups. And do you see that they're pretty similar? I might say, well, there were heavier people in the control group than there were in the standard group, and I might say by a 2% margin. So this is really a judgment call sometimes. Sometimes they'll give you p-values out here and show that they're not statistically significant by showing that they're greater than 0.05. But in a lot of cases they're just listing them, and you're having to kind of look through and say, well, I think they're pretty similar. So let's do that. Do you think these things are pretty similar? The number of COPD patients, there were 9 in this group and 8 in this group, so 9% versus 8%. How do I know other percent? Because they're telling me here. The number of people who had renal disease, the number of patients who had emergency surgery seems pretty similar, pretty similar, pretty similar, pretty similar. I would say that looks fairly similar. So I would say, to answer this question, I might say I compared the baseline characteristics, and with the exception of, let's look at this different. The percentage of patients who had shock was higher in the Precedex group than it was the control group by 4%. So it's you just making a judgment call. You're not having to submit a whole bunch of math. I'm just having you go through these quickly. And I say, other than that, maybe when I come to these, we're getting higher, and I'm not going to give you a set thing to say if it's off by 15%, obviously. But if you get around 3 or 4%, that's kind of you making a judgment call. And you just say something like this: there were more participants in the Precedex group that had abdominal and thorax as their site of infection than in the control group by a percentage of 4. Okay? That would answer that question. So are the participants fairly similar in their baseline characteristics? And then can you think of one confounding variable that the authors hadn't included either in the baseline characteristics or their inclusion or exclusion criteria that might affect the outcome of this study? Masking or blinding. Are the participants able to know whether they got Precedex in this study or another sedative? And do the investigators or the researchers know that too? This is called blinding, and we can have double blinding where the participants and the researchers don't know, or we could have single blinding, or we may just have everybody knows but there's independent researchers who don't know. So let's try just looking for, that's one way to do it. It says, hey, it was unblinded, but the scoring system they used, those were done by nurses who were not blinded, but they assess patients using a really strict scale. Okay, that could answer it. That's the only place they have blinding, and it's not the best place, right? Because it's clear in the discussion. I'm going to go back here, and sometimes I just have to use logic that says, how about if we do aware? Because that would be the other way to say this, is they were aware of which group they were in. And sometimes you just have to do it the hard way. So I read the randomization information, and it says, okay, would the nurse have to know who gave this medication, whether they were giving dexmedetomidine or they were giving another sedative? Yes, they'd have to know. So the nurses would know. The patients wouldn't know, but they probably signed a permit to be in the study. And so sometimes it's just logical that you say, it makes sense to me that the people providing the medication would know, but that the patients would not know. Okay, and then sometimes that might be in the study protocol too, that will be included in your supplements. And I apologize because I could have looked at this study a little more detailed too, but I'm teaching you. How about if you just pick it up and you really haven't had a chance to sit down and read everything? Now you know as you read it what you're looking for. So I'm going to say it was not blinded, but that people who did the analysis were using tools that would make it so that there isn't a whole lot of wiggle room. Okay, that sounds really technical, doesn't it? Okay, let's look at our next question in the process. We go here and we say, okay, next. We're in the assessment section, and this is looking at what did the authors choose to measure as outcomes or endpoints in the study in the control groups. And the first part has me answer, do I think that those outcomes, the primary and secondary ones, were appropriate? The second piece says, did they describe to me how they were going to accurately and precisely measure those? And these terms, accurate and precise, are explained in your week 2 assignment document and some of the reading that you do. When we get to question 10, complete and unaffected by observation, it says, is the follow-up of participants nearly 100% complete? And that follow-up means not the length of the study, it means did the same number of participants who started the study in the study, or were the authors fairly transparent in telling you what happened to them? So these I'm going to kind of address as a group. Were the outcomes appropriate? Well, let's identify what those outcomes were. So here's primary and secondary outcomes. So there were 2 primary outcomes, 28-day mortality and ventilator-free days. If you were doing a study to look at mortality and to look at ventilator-free days, does it make sense that you'd pick those as your outcomes? So you'd say, yeah, of course, that seems like logical outcomes. Now you look for any secondary outcomes. Here we go. Secondary outcomes included length of ICU stay, we call that LOS, length of hospital stay, the RAS score, the CAM ICU score, and I bet a lot of those you were using those in your ICU. They're a measure of, are we letting patients just be delirious all the time, or are we assessing them for that? We're looking at the SOFA score, that sequential organ failure assessment. You'll notice that spells out SOFA. We're looking whether they had DIC. We're doing a mini mental state exam score. We're looking at serum urea, nitrogen, and creatinine levels. Now, I can find this listed here, but I'm probably also going to find it when I go down to their outcomes. Look at this. Here's their secondary outcome measures, and here's their primary. So here's their 28-day mortality, ventilator-free days. Here are some of their secondary outcomes, not all of them, so this is probably the best place to get it from. And again, I could cut and paste, but be picky in what you cut and paste. So what were the outcomes they chose to measure? Secondary outcomes included C-reactive protein, procalcitonin. Well, all those are markers of inflammatory process. Prealbumin, is your liver still working? Are you able to make coagulation factors? So I'm not asking you to know a whole lot about the diseases, but does it make sense if you were setting up a study that would look at acuity of patients who had sepsis and their mortality and their ventilator-free days, that you would track those? Does it make sense you might look at some of these markers of an inflammation or scorings, their scores on scoring system that tell us how critical a patient is? So they had primary and secondary outcomes, and I would list those, and that would answer this question. What are the primary and secondary outcomes? Now move to, based on those outcomes, are they careful in telling you how they're going to accurately and precisely measure them? Well, let's look at this. Some of these are going to be pretty straightforward, I say. Of course, if I look at your outcome, sorry, I need to get back here, 28-day mortality and ventilator-free days. So they say, okay, ventilator-free days were calculated in the first 28 days, or days alive minus days under mechanical ventilation. Now they're going to tell me how did they measure whether the patient had hypoxemia or something. Does this seem like they're being fairly transparent or fairly specific in telling you, okay, whether they had a PO2 less than 60 on 50% oxygen or more? If they were on PEEP of less than 8. So they're talking about ventilator-free. So here's their predefined criteria for improvement of underlying illness. Was the patient improved? Secondary outcomes, length of stay. So they did the SOFA score. They did all these scores, but did they tell me how they're going to measure that? So they're going to measure procalcitonin levels, daily energy intake by enteral nutrition, and prealbumin levels, and they should tell me how they're going to do that. So I say they're using fairly common scoring systems that will tell us about severity of an illness, and that these are trying to take something that could be subjective and make it objective. So if you know anything about the scoring system, they are ones that there's not a lot of wiggle room in them, and you could even say that. So I think the authors provide, my answer to this one would be, I think the authors provide enough information about how they will determine improvement in care. Number of ventilator-free days is fairly easy to calculate. Whether the patient died or not is fairly easy to measure accurately and precisely, and that the scoring systems they used, or the fact that they were doing lab testing that has an outcome, a number that's measured, would tell me that they seem to be able to accurately and precisely measure that primary and secondary outcomes. Okay, so don't just say yes. That's never an okay answer, or no. It is, give me an answer to the question and your evidence to support it. We've got this last thing and then we're done. Complete and unaffected by observation means, did the same number of people who started the study end it? Let's go back to this little table. Did the same number of people who started this study end the study, or are the authors transparent in telling you what happened? So 100 started the study, 99 were randomized correctly, one of them got discharged before they ever got to receive the intervention. Okay, this group, 95 got the intervention as randomized, 6 of them got the wrong medication, right? They weren't supposed to get dexmedetomidine in this group, but the physician overrode what they were randomized to, but they were still included in the analysis section. So does it seem like the authors are being transparent? Did the same number of people who started the study end the study? Well, 100 people started, 100 people were included in analysis, but I'd probably clarify and say there was one who they didn't have the records for, or was discharged before they were able to intervene and provide the intervention. Okay, in this group I would say there were 6 who received dexmedetomidine instead of the medication they were supposed to receive, but they were included in primary analysis. So yes, the authors are being transparent. So I hope This video introduction to the Marie process helps you be able to approach your homework questions this week with confidence, but more importantly, that it gives you skills that you can take into the future and continue using as you analyze studies. That will give you that confidence to do that and know exactly what you're looking for as you read a medical study. All right, I'll get this published.